Good afternoon, Dr. Trinh. Thank you for being with us today. We are going to talk about a subject that a lot of people say is taboo and they don't want to talk about it, but it's become a worldwide epidemic, and it's obesity. Can you tell us a little bit about yourself and then talk to us about obesity, please?
Definitely. I'm Dung Trinh. I'm a board certified internal medicine specialist and have taken care of patients for close to about 20 years now. And yes, obesity is an issue. Here in the United States, 2 out of 3 Americans are overweight. And so with obesity comes along a myriad of other health conditions that is tied to obesity, including heart disease, including diabetes, high cholesterol, high blood pressure. And did you know that there are over 10 cancers that are linked to obesity? It's so it's an epidemic that we need to address, because if we can successfully address obesity, all these other health conditions that are tied to it will address itself as well with that. Now, obesity is an interesting thing. When we think about obesity, we think about, eating a high-fat diet, right? When we think about obesity, we think about fat. But I want to give you a quick overview that when we have a chance for a more full lecture, I'm going to dig into the details. But let me tell you now that obesity isn't necessarily from a high-fat diet. There is another diet that is feeding obesity today, and a diet that Americans, and not just Americans, but in any developing country is facing today. And that's a diet that is loaded with carbohydrates. White bread, white rice, pizza, potatoes, spaghetti. And when we have a chance, I'm going to give you the science behind that and how this lifestyle, which is the American lifestyle, the Canadian lifestyle, the European lifestyle, and even in Africa, when a lot of us rely on specifically simple carbohydrates as opposed to complex carbohydrates, it is feeding this problem of obesity today as well. And we'll go into details when we have a chance with that.
We also noticed, and I've heard them talking about COVID-19, that people who are obese have more of a tendency to get the COVID-19. Can you tell us a little bit about that, please?
Yes. So everyone can get COVID-19, but those who are obese have it worse. Those who are obese and with the associated diagnosis that are linked to obesity, including high blood pressure and heart disease and diabetes, those patients tend to be the ones who are hospitalized. Those patients tend to be the ones that die from coronavirus. So yes, very linked to it, and very a very significant topic for discussion, especially during these times with that.
Is there a difference between the younger people that are obese and the older people that are obese? Is there a difference in disease cycles?
Those who are young with obesity have definitely a higher risk of developing these complications as they get older. So if you start, obesity when you're a high schooler or a teenager, your risk for diabetes starts earlier. Your risk for hypertension starts earlier. Your risk for heart disease starts earlier. So it's the years of accumulation of these risks that's associated with obesity. So it's linked in that way.
So how do we get our younger people to, especially here in the US, to eat a better diet, especially when they're busy with school, with work, with all of that? How do we get them to eat a better diet?
It starts with education. It starts with bringing awareness that obesity isn't all about a low fat diet. Obesity is about the other things we put in our mouth that is driving it. So awareness and education starts first. And then we will give practical advice and practical tips on how to lose weight without trying to lose weight.
Fantastic. Well, thank you. We look forward to hearing more about that. I'm sure that will be something a lot of people will like to hear. Thank you, Dr. Trinh. We appreciate you being here, and God bless you.